Hi, my name's Corey. I have been asked to make some videos based on my experience that I've had being a disabled person. As of recently, I have been a chronic pain patient for 6 years now. I'm on Norco 3 times a day, along with other medications. I was in a car accident in 2005, which led to three ruptured discs in my lower back, L3 through S1. Then later in 2020, pushed out my C6 to C7 disc. I'm allergic to morphine, among other things, so I usually get Dilaudid IV between 0.5 milligrams and 1 milligram while at the hospital. So from late 2022 to early of 2024, I have had 5 major surgeries, which I will talk about in later videos. So be sure to follow. When it comes to my back, I've had everything done from creams, patches, steroid injections, local blocks, lower lumbar ablations of nerves, and I also have a spinal stimulator implanted in my lower back. I have had 4 lower lumbar ablations done within the last 4 years with no problems at all. I've actually had it help my back, but recently I had a lower lumbar ablation done in my lower lumbar on my left side, which ended up creating inflammations in the nerves surrounding the area in my back. Soon I started feeling a lot more pain, inflammation, and it got so extreme that it felt like I had lightning going through my spine. So I reached out to my pain doctor and let him know what was going on. He reassured me that this shouldn't happen with this kind of procedure, that I shouldn't be having this kind of pain, and that I needed to reevaluate my pain medication, my pain regimen, and to see if there was something else that we could do. The pain ended up becoming so intense that I had gone to the emergency room a couple of times, and I was admitted twice. And I had seen a neurosurgeon who informed me that the doctors don't always tell you that when you get a nerve ablation done, that it can irritate the other nerves or the nerve branches around that area. And there's not a whole lot you can do except for rest and try and use heat and ice and things like that, and things that might be a little more homeopathic, which in my case didn't help. So I had an appointment with my pain doctor and I let him know what was going on, and he said he wanted to request my records from the hospital, which I said was fine. And later on that day, I got a call from his medical assistant saying that my pain doctor would no longer prescribe me Norco and that my only choice was to get on Suboxone, which is also considered a buprenorphine. And I've had it before, which made me sick, but since I had no choice, it was either go through withdrawals or start a new medication that I knew was already going to make me sick. So I started taking the Suboxone, and immediately my legs started swelling. I got swelling in my throat, in my forearms. I was having urinary retention, abdominal pain, and 80% of the time I wasn't very lucid. And so I let the doctor know, or at least I let the medical assistant for the doctor know. And she replied back to me and told me that my doctor thinks that I have a problem and that I need to go to a methadone clinic and see if they could help me. So I was pretty scared at this moment because I was not only mad and confused about the situation, but I knew that I wasn't an addict. I knew that I didn't have a problem. I just knew that I was in chronic pain, that the Norco wasn't helping. I have other medical problems that makes it hard for me to take any steroids or muscle relaxers or Advil due to GI issues. And so I'm pretty stuck to the opioids. And so because I was so frustrated, I did decide to go to a methadone clinic. I sat down with an associate there, and then he also talked to his manager. And he said, "You don't have an addiction problem. You have a chronic pain issue." He said, and we see a lot in chronic pain patients, and unfortunately, they get stuck in a loop where you do have to become dependent on a higher medication for your pain. And he said, I would suggest going and finding another pain doctor right away. So that way you can get off the Suboxone and then also get back on your Norco and, do what's better for you. So that's what I did. I contacted my doctor. I got a new referral for a new pain doctor. And I called my pain doctor that I had and asked for a letter stating that I was no longer seeing them, because if you have a pain contract, you can't be seeing two different pain doctors at once. And so they were fine with that, letting me know that they were no longer treating me. And I was able to see a new pain doctor who had no problem with me getting back on my Norco. And she also said that the Suboxone or the buprenorphine is actually a very bad medicine. She doesn't prescribe it. It makes you feel like what I was going through. And unfortunately, a lot of patients have to go through that before they know that it's not a medication for them. So back on my medications, and I'm just hoping that this video reaches somebody out there, at least one person, to help you know that you're not in pain alone. You're not suffering alone. There are a lot of us who are in chronic pain daily, and that if a doctor disagrees with you, you know your body better than anyone else does. You can have doctors and nurses tell you their opinion, and you can take it with a grain of salt. But ultimately, you know what's right for you and what is going to work for you. Don't let anybody tell you that you can't be allergic to a certain medication, or that medication shouldn't do that to you. Everyone is different. We're all built with different chemistry. Our bodies react to different things, and you have to be your own advocate. And I've been in the healthcare field for over 16 years now, and it saddens me to see and hear a lot of healthcare workers treat their patients the way they do. And I will be making more videos of some of my experiences, and maybe some of the back room talk that you don't hear doctors say or insurance companies say. And I hope that this helps you, or a lot of you, in some way. I hope you have a great day, and God bless.